Joining me live to talk more about this and some other health topics this morning, Dr. Pernell. She's a public health physician and regent at large for the American College of Preventive Medicine. Doctor, good to see you. Let's start with the mRNA vaccine and the possibility that this type of vaccine could fight cancers. Specifically, what type of tumors would it be able to go after, and why is this so critical?
Good afternoon, Marni. This is really important news because as we learned during this COVID-19 pandemic, the flexibility or agility even of the messenger RNA vaccine science really is mind-blowing because it is basically given genetic instructions to the body to produce an immune response. There are potential breakthroughs, not just in infectious diseases, but in cancers. And those breakthroughs in cancers can be malignancies associated with skin, like melanoma, or it can be other soft tissue tumors. We're really excited to see just how far mRNA vaccine technology can prove to be useful. And we're thinking that it can be proved to be useful in autoimmune disorders as well as rare diseases. So it's really encouraging that this science really is playing out to be more than just one magic bullet, but really a powerful tool in our toolkit.
And if they move forward with this and we see more positive results, would this be something that would be included in like a childhood vaccine series? When and who would be eligible?
Well, what we're seeing right now are breakthroughs in the treatment of certain diseases. So not necessarily as part of a childhood vaccine schedule, but a vaccine schedule that could be made available to those who are either at risk for progression of certain illnesses or who have been diagnosed with illnesses. We're talking about a wide array from cardiovascular or heart disease to cancers to autoimmune disorders to even rare diseases. We do know that we continue to see progress in infectious diseases, as you mentioned, with a vaccine likely coming available for RSV. So we're eagerly awaiting to see just how far this science can be taken.
And it sounds like an RSV vaccine maybe sooner than the other, which is great news. I want to talk about this rise in STDs nationwide, some attributing that to some of the habits during the pandemic. Tell us more about doxycycline, this drug that could battle some of these diseases.
So doxycycline is a popular antibiotic that we use against bacterial infections. It's been around for about 50 years. It's readily available and has an affordable cost range. What is powerful about this information that we're seeing from this trial is, though we've seen a rise in sexually transmitted infections during the pandemic, we could possibly have a tool that can be used within 72 hours of unprotected sex in certain communities or populations that would drastically reduce their incidence of developing chlamydia, gonorrhea, or syphilis, which really have been rising out of control. We think these infections have been surging because a lack of STD screening during the pandemic. Recall, people were not seeing their regular providers, or regular medical services were not easily accessible, and because of a lack of literacy around sex education and how we can best keep ourselves healthy, as well as declining usage of condoms during sexual activities.
Developing news that has a lot of people's attention, the free COVID test, Dr. Pernell, going away. What are your main concerns about easy access to these tests and the role that they have played over the last 3 years?
My main concern is we know that when prevention removes cost barriers, people are more likely to complete those preventive measures or those health promoting or health seeking behaviors. The fact that insurance will no longer be required to cover up to 8 at-home COVID-19 tests may mean that people have symptoms and they're less likely to test. Then they would be less likely to have access to something like Paxlovid, which we know needs to be taken within 3 to 5 days of testing positive. This is just another example of how the United States struggles with universal health coverage and understanding the power of universal health coverage in preventing not just infectious diseases as this pandemic, but in preventing a host of chronic health conditions. So I'm hopeful that we will have some healthy pushback and a vigorous conversation about how long at least the vaccines and other treatments remain readily available. But it is somewhat disappointing that these tests will no longer be covered at the rate that they are.
After what we all have been through with the pandemic, anytime someone's sick, they reach into the pantry for the COVID test, they test. What's a good, healthy practice moving forward when you start to show symptoms? Maybe it's a cold, maybe it's COVID. The steps people should take before they see their doctor.
Definitely, because we're also in the waning part of the flu season, as well as the burgeoning part of the allergy season. If you have any upper respiratory symptoms, if you have a cough, if you're sniffling, if you have a runny nose, you should test to make sure that it is not COVID. That's what I do. If you're going away on travel, you should test to make sure you're not going away unknowingly sick with COVID or upon returning to travel. And if you have high-risk individuals in your household and you're going to have a large gathering, or you've recently participated in a very large gathering, you should test. So those high-risk individuals are elderly persons, young persons, people with chronic health conditions, someone who is pregnant, anyone who is at risk to have more severe outcomes from a COVID-19 infection.
And the CDC is saying if you test positive for COVID-19, you still should stay home for 5 days and isolate in your home before going out into the public. Dr. Chris Pernell, great information as always. Thank you.
Thank you.